SNS institution, a multidisciplinary global institution, and the first institution to implement design thinking curriculum in education. Our institution works based on a holistic 5-group building centers. The 5 pillars are Center for Learning and Teaching, Skill and Career Development, Center for Creativity, Industry Institute Partnership Cell, and Social Responsibility Initiatives.
Hi everyone, this is Siddharth VM, BPT first year from SNS College of Physiotherapy. On this 5th day of IAPC, I would like to welcome our guest speaker, Dr. Arun Raj. I hope you're safe in this pandemic situation.
Hi Siddharth. Yeah, I'm doing good. Thank you so much for your concern, and also thank you so much for this opportunity. So I'm Dr. Arun Raj, 2013 batch from Velamal Medical College. I'm currently working as an COVID medical officer in Government Rajaji Hospital, Madurai, and I'm also working as a duty medical officer in AVSS Hospital and Trauma Care Center.
What made you to become a doctor, sir?
I've always wanted to become a doctor since my childhood. My inspiration, I would say, is my Perima, my mom's elder sister. She's a cardiologist, Dr. Silvarani, in Government Rajaji Hospital, Madurai. And my mom is a staff nurse, and most of my family members are medicos. So my whole family has been kind of an inspiration for me to take up medicine. That's all.
Now let's discuss about the topic rheumatoid arthritis.
Yeah, coming to our topic, rheumatoid arthritis. We all know that it is a chronic inflammatory disorder affecting the joints, especially your wrists, your fingers, your knees, your ankles and your shoulders. Most of the patients present between 30 to 50 years of age, which is pretty young, and most of them are women. Women tend to be affected like 3 to 4 times more than men, and there is also evidence of family history too. Since it is an autoimmune disorder, multiple organ systems get affected, and patients tend to die at an early age. So what happens here is the synovium or the joint lining, it gets inflamed, and eventually the cartilage gets destroyed, which leads to inflammation of the joint. Patients come with complaints of swelling of their joints, their severe pain. They will have redness, they'll have warmth around the joints. Eventually, as the years go by, the joint gets destroyed, joint go for deformity, and ultimately they will end up with their quality of life gets affected. So how to pick up patients? It's pretty easy. The patient, and young patient, comes to your clinic with complaints of severe joint pain. It is very obvious that it is rheumatoid. How to confirm it? After examining the patient, I will order for the screening test, which we usually do, which is RF, rheumatoid factor, which is quite sensitive. But to confirm the diagnosis, I will go for this antibody testing, anti-CCP antibody testing, and there's also this, we have X-rays to pick up joint damages. But to say there is no cure for rheumatoid arthritis, there is till now, as of now, we have no cure. The treatment is to reduce the deformity, reduce pain, reduce the progression of the disease, give some more time for the patient to live. Yeah, so what are the treatments? Going for drugs, we try NSAIDs, non-steroidal anti-inflammatory drugs. We give low-dose steroids. We give physiotherapy. We provide the patient with DMARDs, which like methotrexate, chloroquine, hydroxychloroquine, penicillamine. These are all drugs that reduce the pain, reduce the inflammation, reduce the progression of the disease, and it gives the patient some more time to live peacefully without pain. There are surgical measures too, like we go for surgical measures only when the patient goes for a severe form of disease like more into going into deformities and disabilities. So what are the surgeries? Most commonly we do synovectomy, which is removal of this affected synovium, the inflamed synovium. So when you remove it, the inflammation comes down, the patient feels less pain, or we try to reduce the inflammation. And there's also ultimately patient when they cross 50 years of age, or when they go into severe form of the disease, they do replacement, knee joint replacement surgeries or arthroplasty. um, there is also a procedure called arthrodesis, where they fuse the joint, so we don't allow the joint to move, so that the patient doesn't feel any pain.
And why is this rheumatoid arthritis is different from any other arthritis?
Yeah, there are other forms of arthritis like osteoarthritis. We have osteoporosis, there's gout, there's psoriatic arthritis. The thing is the age difference. Usually, elderly people get osteoarthritis and osteoporosis. It is a slow progression. People don't die of osteoarthritis or osteoporosis. And there's gout, there's this uric acid deposition in the dots. It usually affects the toes. It is also a painful condition. But how does rheumatoid arthritis stand out? It is the age. Very young people coming with painful joints is really pathetic. They cannot do their regular activities like other people of their same age group. So that's the difference. And also when it becomes severe, and when it becomes a multi-system involvement, people die at an early age compared to people at the same age, at their own same age group. So that's the difference here.
And is surgery the only way to treat the rheumatoid arthritis?
No, as I said earlier, surgery is not the only treatment for rheumatoid arthritis. If we pick up rheumatoid arthritis at an early stage, we can reduce the progression of the disease. We can slow it down. Like we can do exercise, we can do physiotherapy for the patient, we can give NSAIDs, we can give DMARDs, we can offer dietary advices. So there are a lot of other things. When we pick up the case at an early stage, when the disease goes for a severe one, then no other go. We have to go for surgery. That's the only option.
Is any deformities of joints occur in this condition?
Deformity, yes, we do get a lot of deformities, especially in hands. We have names for it too. There's this bottine deformity, we have this swan neck deformity, there's this Z deformity. Your hand goes for ulnar deviation, you name it. Each and every joint gets affected. As the disease progresses, your joints become more deformed, and ultimately it leads to disability of the joint.
Sir, what are the non-surgical treatment options for rheumatoid arthritis, sir?
Non-surgical therapy, yes. Starting with diet, patients should take a healthier diet. They should take more of fish. Omega-3 fatty acids is good for them. They should cut down alcohol and smoking intake. Cut down all the junk foods. Coming to physiotherapy, yes, physiotherapy plays a major role in reducing the progression of the disease. There are a lot of modalities of treatment available nowadays. They do hot and cold fermentation, they do electrical stimulation like TENS therapy, they do hydrotherapy. The proper and the safe stretches, the exercises, the muscle strengthening exercises, each and everything is important for the patient. It allows the joint to function better. It allows the joint to move and not go in for stiffness. Physiotherapy also provides the patient and educate the patient about this joint assistive devices, joint protection strategies like splints, these rehab assistive devices that people use when they go for a severe form of the disease. Physiotherapy has been and it is to say the most important part of treatment in rheumatoid arthritis.
Thank you, sir. And we are going for the last question. What are your future plans, sir?
Future plan, yeah. My obviously, I'm an aspirant, so my plan is to get a PGC, to get a good rank in NEET PG. I've always wanted to become an orthopedic surgeon. I'm working on it. Hope I get my seat.
Thank you, sir. Thank you so much. That's a wonderful section with you, sir. And I thank you on the behalf of SNS College of Physiotherapy Department. We had a wonderful session together, sir. And once again, thank you for spending your valuable time for us. And I'm wishing you all the best for your future plans. Go ahead, sir. Stay home, stay safe. Thank you so much, sir.
I hope this was an useful session, and I once again thank everyone for the opportunity. Thank you.